What we try to find is a surrogate parameter that we can measure early on, which relates response to overall survival. Now, the first step was to investigate early tumor response, that we abbreviate ETS, and we could find that early tumor shrinkage was in fact related to overall survival. So patients reaching an early tumor shrinkage of equal or greater than 20% had a prolonged survival. This was to some extent not understood. And then we looked at depth of response, and we could demonstrate that early tumor shrinkage was a very good predictor, if you want, of chemosensitivity and thereby of depth of response. And depth of response in itself was very well correlated to overall survival in colorectal cancer. Most important is that depth of response goes one step beyond RECIST. In RECIST, we differentiate stable disease from partial response from complete response, which categorically differentiates different response, if you want, categories. Now, depth of response is a continuous parameter, which goes from, let's say, 0% to 100%, and 100% would be complete response, and 0% would be no response at all. So by looking at depth of response as a continuous parameter, we can, for a single patient, more precisely demonstrate how effective treatment was. While, let's say, partial response just categorically defines a patient that has a tumor reduction of more than 30%.